Hello, my name is Dr. Andrew Sanderson, and I'm a practicing physician and the Chief Medical Officer for the Water Environment Federation, or WEF. WEF is a not-for-profit global membership association of water quality professionals with a mission to connect water professionals, enrich the expertise of water professionals, increase the awareness of the impact and the value of water, and to provide a platform for water sector innovation. Today, I'm joined by Dr. Art Umbel, Global Practice Leader, Wastewater for Stantec, and the chair of the Blue Ribbon Panel that WEF commissioned to evaluate information on biological hazards and safety precautions following the onset of the coronavirus pandemic. As this Blue Ribbon Panel preceded my tenure here at WEF, I want to commend the organization for having the forethought to anticipate the questions and fears surrounding the coronavirus infection and the possibility that wastewater could spread infection, and moving to answer those questions using science and the practical application of safety precautions to protect not only workers, but also the public. Art, thank you for joining me to talk about the Blue Ribbon Panel and its findings. Before we jump in, I was reading your very impressive biography, and I was wondering if you could tell me a little bit about your background and how you became interested in environmental engineering.
Well, thank you for having me, Dr. Sanderson. I appreciate that. And as a quick overview of the background, interestingly enough, I started my career as a structural engineer in steel and concrete construction. And it wasn't until I spent a couple years overseas doing some service work in China back in the late 1980s that I was exposed to the questions about environment and the impact of economic growth on the environment and the things that we should pay attention to. And that changed my entire view about engineering and career and so on. And so that's where I got my interest in environmental engineering. So that's where we brought it to today.
Great. Well, we're very lucky at WEF to have you as part of this organization. I wanted to know, what were the goals of the Blue Ribbon Panel, and do you feel they were achieved?
So the primary goal, Dr. Sanderson, was we recognized immediately through some discussions that took place back in late March of 2020 that the amount of guidance and attention that the wastewater community in general was receiving with regards to this highly uncertain condition that was being posed by the COVID crisis even at that time, that the communications were unclear for a lot of people. There was a lot of uncertainty about how to respond to this as a wastewater community. And then more importantly, we recognize that there is still quite a bit of unawareness about what is the appropriate guidance to provide to wastewater workers or anyone involved in exposure potential to wastewater itself, where other pathogens that are more than just this particular virus could be present. And that could we then take a step back and develop an immediate response to the wastewater community, which is represented by WEF across the globe, to provide, in my view, a very concise update from what we know about how to protect and prevent the transmission of illness in wastewater activities, and particularly in the collections and treatment of wastewater for the community, and primarily just to begin to address as best we could the uncertainties that many folks had in their minds. And to answer your question, I do believe we achieved that goal, and the document that is available now to anyone who has desire to understand this more deeply, and the information that's present, I believe, does address a number of these questions and provides very appropriate and pragmatic guidance.
Yes, I definitely agree. I mean, as scientists, obviously, when there's uncertainty, what we want to fall back on is data. And I was wondering if you could tell me a little bit about how you and WEF assembled and organized your team of experts on the Blue Ribbon Panel to tackle these issues.
So the emphasis, again, as you point out, was to take a close look at what the data tells us and where the data is coming from, and how do we establish guidance around data that we can understand, as well as data where we know there are gaps. And so we looked to a number of agencies, Dr. Sanderson, with respect to the global agencies that we knew would have guidance similar to what WEF has had in this arena in the past. That would be the World Health Organization, for example, Centers for Disease Control, US EPA, Occupational Safety and Health Agency, and so on at the federal government. All these agencies have guidance documents that are about how to prevent from pathogenic biological hazards, as example. But what's interesting when you look at those closely is that they aren't necessarily always particularly focused on those who work specifically in the wastewater industry or who are exposed to wastewater potential pathogens that could be present. And so we wanted to make sure that we looked at all those guidances and developed from those an update to our own guidance, which WEF has, and it has published through the Method Manual of Practice #1, specifically in Chapter 8 in that manual, that deals with biological hazards within wastewater. And we wanted to be consistent with the message and understand where the gaps were with what our wastewater workers are exposed to, and be able to provide additional guidance as well as supplement the guidance from these other agencies, so that we're presenting a fair and clear story and clear message about what we know about this particular virus, as well as what we would compare it with in terms of our practices of always being prepared and preventive of illness transmission.
Yeah, that's very interesting. I mean, you mentioned the World Health Organization, and as we know, that organization has a very broad mandate for public health. Were there any other organizations or entities from other countries that you identified to compare policies for wastewater sector workers?
Not outside of WHO. That was the most comprehensive one that we found in order to be able to address the issue as quickly and as concisely as possible. And we felt that because they are very engaged in numerous countries around the globe on a variety of issues, that we could pretty well decipher from their guidance what would be appropriate. And so that's where we put our emphasis.
Okay. Well, after reviewing all of the data and looking at the policies of various organizations, what are the best practices for protecting the health and safety of wastewater workers from SARS-CoV-2 or coronavirus?
So this is really the core question, Dr. Sanderson, that we wanted to get to. What are the appropriate practices and how do we arrive at that? What we know is that always in the wastewater industry, since its inception, and WEF has been a strong proponent since its formation as an organization, that pathogens of all types are present in wastewater, and it becomes imperative that anyone who works in a wastewater environment is well informed about the appropriate protocols to take to not just prevent from being exposed to these things, but also to take special care to ensure that we don't transmit these illnesses inadvertently in ways that we may not even know. At that particular point in time, when the SARS-CoV-2 came onto the scene early this year, it was very evident for us that we had no specific data to guide us in terms of what are the appropriate practices. So the question then reverted back to, if we look at what our protocols are now for addressing other known pathogens that we have been around and we have been recognizing are present, do these protocols still stand, and can we apply them appropriately for the SARS-CoV-2, which is the virus, of course, that creates COVID-19 disease? Are there differences that COVID-19 requires of us from what we had done previously, or do we just simply need to up the ante, if you will, on protocols that we already use? What we have learned and what we gathered from our studies is that the standard protocols that we've always applied for the protection against pathogenic organisms of all types that we know are present in wastewater, and we've documented these things, they remain still appropriate for protection against the SARS-CoV-2. What the difference is is that we recognize that we need to promote an even more diligent attention to these protocols than ever before. Wastewater treatment in and of itself as a technology is effective at removing viruses of all kinds. We've seen this for decades, be it through disinfection practices, for example. But we have no evidence to show at this point that the SARS-CoV-2 virus would respond any differently to the normal disinfection practices that we exercise in treatment today. And the reason for that is that we have no evidence yet to show that the virus of COVID-19 survives the water environment, and particularly in wastewater, to the point where it remains infective. As a result of that, we conclude at this point that with the data we have, that our treatment is effective. To put it further then, to say, what are the appropriate protocols that we should use when we are being potentially exposed to this kind of a virus is no more different than what we've always emphasized. And so in our particular case, as we have for others, we really emphasize the use of face shields and masks. We did differentiate between whether it was appropriate for the worker to apply the N95 mask or a respirator as opposed to a surgical mask type, but the evidence continues to be clear today that the standard mask that we recognize of the surgical mask type does provide adequate protection. We also want to emphasize the attention to the types of protective clothing and latex gloves and a proper boots and so forth, because of the impact that we can transmit this type of virus due to its settling on surfaces. We call those fomites kind of transmission potentials. And so we must be protective of ourselves from those kinds of things. The key, though, is the awareness of the activity that each individual is engaging in at the wastewater plant or in the collection system. And I want to emphasize the fact that we need to pay just as much attention in the collection of wastewater as we do in the treatment of wastewater for the potential exposure to this kind of a virus or pathogen that we've always been attentive to. And there was quite a bit of discussion then around, what about aerosols? Can this virus specifically be transmitted via aerosols? We know that the virus can be present because of what we've learned through qPCR testing, but we have not to this date found any evidence that the virus can survive in aerosols and be in an infectious state. So until we know that, we, as a proven fact through epidemiological studies and through other specific research that's actually ongoing right now, we do want to emphasize to be precautionary and use these kinds of protocols, because yet we don't have those final answers. But I would emphasize the fact that we do not have any evidence at this point that the infectivity, some people use the word viability, of this viron can continue to be present in a wastewater such that it is transmittable through aerosols. So I think we need to keep that in mind, but still exercising the appropriate protocols that we've always exercised, but simply being more diligent to that.
Yes, I think it's critically important that you address those issues. When I was reading through the Blue Ribbon panel report, I was very happy to hear that the data did not show that there was any infectivity in the actual wastewater itself. And in the medical community, there's been a big discussion back and forth about the usefulness of using medical surgical grade masks versus the N95s. So I think that was an important point to bring up. As well as the specific issue about aerosols. Initially, we were told that this virus was transmitted basically through respiratory droplets, if someone was coughing or sneezing or talking, and also contact with contaminated surfaces. And then later on, it was revealed that aerosols were also a problem. So I think the fact that the report identified and addressed those issues was very, very important. I want to shift focus a little bit to talk about the mental health burden of the pandemic. which I think is particularly significant. So much so that psychiatrists and psychologists have developed a model called COVID stress syndrome. And it has distinct but interrelated elements. One is the fear of danger from COVID and getting infected. The other is worry about the social and financial impact of the virus. Another is concern that foreigners, and even I read as late as yesterday, the worry that healthcare workers can spread the disease, so that people are keeping themselves away from known healthcare workers because they're worried that they could get COVID from them, as well as compulsive checking, checking of temperatures and seeking reassurance. So it seems that no matter where you are in the political spectrum, whether or not you're worried about the disease itself or you're worried about the financial impact of the virus, there's a lot of stress related to COVID. So specific to that, could you talk about instances where wastewater workers, could you talk about the ability of this report to both quantify and qualify the occupational risk, and how does that relate to this COVID stress syndrome for wastewater workers?
It's a really excellent question, Dr. Sanderson. And first, let me say that within the scope of the Blue Ribbon panel, we did not address the syndrome itself or the idea around stress. We felt that was out of scope, but we did recognize the fact that the stress is a very real aspect of this particular pandemic that folks are having to deal with. And so one of the aspects of this report that we brought forward that I think is a tool by which you can alleviate some of the fear. I'm not going to say it will eliminate all of the fear, but some of the fear which results in these stresses that we experience. And that is alleviated by really focused planning about the activity that each individual working in these environments pays attention to. In the OSHA standards, there are protocols known as job safety analysis, and in some it's called job hazard analysis. And OSHA has been a strong advocate for the use of these kinds of tools to alleviate people's fears about what they're doing, because it allows them to take the appropriate planning and precautions necessary to ensure themselves that they will be protected from the unknowns and the uncertainties. And so we felt it was really important to include that in the report, as well as provide several examples of how these JSAs and JHAs are applied to any activity. And I have learned that many utilities across the country today are already using these kinds of protocols to do this very thing. If they can properly plan for the activity before the activity occurs, making sure that people, number one, are aware specifically of the hazards. Secondly, they are instructed on how to prevent being exposed to the hazard. Thirdly, how to prevent from transmitting a particular disease if that's the hazard. And then fourthly, how to be able to reset after the activity has occurred to ensure that they haven't promoted the hazard even further. And so a good example of this is if I am a collections sewage worker and I am going to go out into the sewage collection system today and I'm going to jet a portion of the line because it's plugged or needs maintenance, I have to remember that I have a potential to have splashing occurring. There will be vapors in the air. Again, we don't have all the information about how this is transmitted, but I will go through a job safety analysis protocol before I go out there to clearly define the activity, define all the potentials where those hazards could occur, and then I will define all the appropriate PPE to apply to that activity. And then I will also apply what other ancillary activities need to take place. For example, in the truck that I use that goes to that site, do I also include disinfecting the steering wheel and the seats where I'm at? What about the coveralls that I'm wearing? Do I bring those back to the break room where I start that day, or do I use a special area of the locker room, etc.? All these kinds of things need to be outlined in detail, and these job safety hazard and job safety analysis protocols allow you to step through that in a very, very concise and predictable way. I am convinced, and others have already shared this, that when they go through this exercise, it does alleviate your fear. It alleviates the fact that I have less uncertainty about what I'm doing, and I have more certainty that I'm doing everything that I can based upon what we know. That in and of itself addresses the fear and reduces the stress and keeps people safe, honestly.
Yeah, I couldn't agree with you more. I mean, I think that the JSA and the JHA are very important tools. And when you get that prescriptive, when you go down to minute details, you help people to remember exactly what they need to do, and that alleviates their stress. In medicine, Atul Gawande wrote the Checklist Manifesto, and that was a way for surgeons to make sure that they were doing things in a succinct order, so that there wasn't anything forgotten or missed, and something taken from another industry, which was aviation, for pilots. So I think that it's best to learn these, best practices from, whichever organizations are doing a good job of it. And I think a second part of it, which is really important, is that because we have so much scientific heft on the Blue Ribbon panel, and because WEF is seen as an honest broker, in the report, it was specifically mentioned what we do know and what we don't know. And I think that when individuals read the report, they'll be happy to know that, they can trust that the organization is going to tell them, all the relevant information, but not leave out things which may be inconvenient. So another thing that I saw recently was a report that came out of China, which was concerned about the possible spread of COVID through plumbing in high-rise apartments. Do you believe that the Blue Ribbon Panel report adequately addresses this, or is there more research that needs to be done?
Yes, the HVAC, or heating, ventilation, air conditioning systems, was out of scope of this particular VRP, Dr. Sanderson. However, there was some conversation that we had around what that scope might need to look like. This is in particular to the literature and research that has been done now for decades on Legionnaire's disease and the way it is transmitted and the way it is sustained within an HVAC system that is not maintained. The questions around that have to do with this relationship to the aerosol issue as well. So it appeared at this time that we would not address that in this particular scope of work, simply because we wanted to focus on the wastewater activities of wastewater workers. And you may say, well, but aren't HVAC systems in our wastewater plants? Indeed, they are. I just don't think that we have, and I know we don't know enough yet about the connection between aerosolic activity of this viron specifically, but we are looking at how we learned about Legionnaire's disease. Are there things that Legionnaire's disease literature and testing that can teach us about the possibilities that this could be an issue in HVAC systems as well? I think that is coming with respect to the research, and I would say when that information becomes known and available, then we would want to update this type of report to include that information.
Yeah, I personally think more research needs to be done. I mean, if you look at it from an HVAC perspective, how do you know that you get the aerosolization from flushing the toilet versus aerosols that come from the person who may have COVID, who's sitting in their home, who's coughing because they're symptomatic? So I definitely think that it needs to be further researched, although we haven't seen any real documented evidence of any fecal oral transmission of this virus. Um, there's been a lot of other research around the world using wastewater as a kind of early warning system to gauge spikes or surges in COVID-19 infections in a community. How do you think that wastewater can be used to slow the spread of infections like COVID-19?
Yes, this has been a very intense topic here in our industry just within the last several months, where a number of utilities around the country are doing special sampling and providing those samples to particularly certified labs that then run a test known as RT-qPCR. RT is reverse transcriptase quantitative qPCR. So what that does, all we know is that this particular test is able to identify fragments of the RNA associated with this particular virus. And through the qPCR, which is polymerase change reaction kind of things, we can replicate that very quickly and know within a very short period of time whether or not the virus is present by the locations of these particular fragments. What we've learned from this so far, I think, is very, very valuable to both the industry and to our public health and healthcare working industry, and that is when we detect this in a wastewater, it is a clear indication that somewhere within that sewer shed that is draining to the treatment plant, there is a person or persons or cohort of persons that are infected with the SARS-CoV-2 virus. What it will say to us is that those persons or person may not even be showing symptoms. It may be all asymptomatic at that particular point in time, and yet the test allows us to say it is present and gives a heads up warning to the healthcare community in that area to say, we do have this virus present, let's prepare. Maybe it's in our hospitals and clinics and so forth to make sure that they are prepared for what could come in terms of the needs to treat those illnesses. What this test does not do, and I want to continue to emphasize this, is that it cannot determine whether or not the viron that's being observed is infective. That is only done through a culture test to date anyway, and so much research is going into reducing the time that it takes to do a culture test or even come up with an alternative method to culturing. But that's the only way that we have at this particular point in time to determine infectivity of that which is detected. So that in and of itself isn't the best way to provide early warning, because sometimes those tests can take weeks to be able to get the results back, and that could be well too late. So the RT-qPCR kind of approach, where we are simply identifying the presence of the virus, I think is a really, really wise approach to giving the healthcare community a heads up and an early warning about what's happening in its sewer shed and to make proper preparations for that. And I think many utilities that are participating in this kind of work now to provide these samples are finding it to be a great partnering effort for the community at large, and to illustrate we are about public health protection, and we're going to participate in this kind of work to make sure that that's promoted.
Yes, I absolutely think it's such an innovative technique and helps the public health and medical communities know exactly where to focus in the community. So my last question, are there any findings from the Blue Ribbon panel that surprised you?
You know, it's an interesting question. Going into this, I knew that we as an industry have always been keen on prevention from pathogenic organisms. I myself, ran a utility for a decade and was interacting with these kinds of activities day in and day out. And at that time, we were spending a lot of time being made aware of our exposure to potential pathogens. So going into this BRP, I didn't anticipate that we would find anything that we weren't doing traditionally and conventionally to protect our workers from these things. What did surprise me, however, was that there is an incredible amount of importance that we need to put much, much more attention to are these administrative controls. And that's where the job safety analysis and job hazard analysis protocols come into play. These have been around for a long time. What surprised me is how little we have used them as an industry. We need to do much, much better at that, I think. And so hopefully what we've learned from this is that COVID in and of itself, I believe, has brought a great deal of new awareness to us as an industry of how important administrative controls are to this prevention. It's not just an engineering control anymore. That's part of it, I agree, but the administrative controls to me are equally, and in some cases, I think, and COVID's a good example, it may even be more important. And that kind of came as a surprise to me. I always thought we did a really good job as an industry, but then I realize now that we should and could and we will make use of these kinds of protocols to make it even better.
Yeah, no, you're right. I mean, you don't always have to create new interventions. You can always use the tools that you already have in your toolbox.
Exactly. That's well said.
So I really want to thank you, Dr. Humble, for taking the time to go through some of the findings of the Blue Ribbon Panel report. I also would like to thank you for your leadership in spearheading the work of the group. And I look forward to working with you to develop innovations in water quality and keep our workers and the public safe.
Thank you, Dr. Sanderson. And I also want to thank all those in WEF who participated in making the Blue Ribbon Panel happen, number one, by convening it, and then secondly, by providing tremendous administrative support. We couldn't have done it without the WEF staff, so I'm very grateful for that.
Absolutely. All right. Well, thank you very much, and you all have a great day.
Thank you.